So without further ado, I'd like to invite Minister Jillian Skinner to come and speak with us about the directions for health reform within the New South Wales health system. Minister Skinner.
Thank you very much indeed, Rohan. I too wish to acknowledge the traditional owners of the land, pay my respect to elders past and present, and particularly any who are with us here today. Director General, distinguished guests, everyone. It's wonderful to see you here. There is one overriding consideration for every resident of New South Wales. They ask, can I get health treatment or health care when I need it? That's the way I started a speech 10 years ago, and it hasn't really changed. This is an important consideration for everyone. It's for patients, their family and carers, but it's also for clinicians and all involved in delivering health care. It's why I have placed such importance on devolution of responsibility for that treatment to be as close as possible to those who receive it and in the hands of those who will deliver it. I believe that the closer we move decisions to local areas, the more we involve clinicians in decisions, the more we make our health system flexible and responsive, the better decisions we make, the better we serve the people of New South Wales. In health, we know that we constantly have to adapt our system to face a rapidly changing and ever more costly world of medicine, treatments and medical technologies. To keep pace with progress in healthcare, we must also progress ourselves. We must continue to reform the way we work to meet changing needs and demands. Over the last year, as part of the O'Farrell government's focus on strengthening the health system to respond to what our community wants and what we know creates good health outcomes, we've done several things. We have changed from a centralised department to a more strategic ministry. We have reduced head office and its functions and staff. We created local health districts and networks and put together local boards to govern local groups of hospitals and health services. We instituted core values as a principal part of the way we do business. And I know that that has been embraced because whenever I visit hospitals, I'm told that they adhere to a set of core values. And they repeat what I said on the very first day I became the health minister. Core values standing for collaboration, openness, respect, empowerment. I think they're fundamental. We also created or enhanced what Garling called pillars to support clinical work and reporting. Each change in itself was significant. Together they delivered changes that shaped major new direction for New South Wales in the way we organise, think about and deliver healthcare to people all over our state. We have been creating a new culture with a different mindset. The next step is to reform how we fund the system and make the activities that are delivered to patients at the community level a key element and predictor of budget. This begins to happen from July the 1st. Reforming funding is the next element in delivering healthcare that is more centred around patients and a health system that is more open to outside scrutiny. The strength of linking funding to activity is that it allows clinical discussion at a local level about health and hospitals and creates clear information about budgets and rich information for clinicians that will enable better local decisions to be made. It will be obvious to all what is happening inside a hospital and district under the new funding system, which is good for patients, good for doctors and good for taxpayers as they will be able to see how their money is being spent. Linking activity-based funding to budgetary performance supports and strengthens initiatives that aim to improve health efficiency, safety and quality. It supports access and demand management. This means our health system will change. Local districts will have to make health and clinical decisions based on new information. Some of these may cause long discussion, but the debate, the discussion, the understanding of what to support, what to fund, what to do locally, what to do as part of a bigger network, what to do as part of this bigger network of the New South Wales will fundamentally strengthen the New South Wales health system and produce better health care for every single resident. Being efficient in delivering health care is also an ethical issue. We can't waste scarce resources. Our budgets are strained. Pressure to do more with less grows every year. The number of older Australians, the complexity of the medical caseload never diminishes. It just grows. It's one impact on an ageing population. Meanwhile, what we can do for patients expands, and it costs, and those costs are escalating. So an effective public health system makes every single budget dollar work as hard as possible. It delivers the best care to patients and offers value for money for taxpayers. From July 1, we will have a mechanism to allocate resources to public hospitals based on services delivered. Fully implemented, the next stage of health reform provides key budget setting and performing directions for managers and clinicians. Clinicians will be at the heart of activity, linked to funding. Clinicians will have to drive the new funding model and make it work. There will be more information, there will be more discussion, good clinical decisions emerge from information. I anticipate the new funding model will lead to stronger emphasis on what works clinically, stronger clinical pathways, more extensive medical collaboration and better health outcomes. For me, this is important because it continues to develop a culture of open discussion and local decision-making that we know supports strong and ethical medicine. This reform is about transparency. Health administrators, chief executives need to be talking with their clinicians about the reforms and collaboratively designing implementation plans. Boards, chief executives and clinicians will be responsible for communicating with their communities. Funding in New South Wales reform in New South Wales begins in 6 weeks. As a state, we want to continue to lead change rather than follow. We want to drive strongly towards a more effective health and hospital system, not wait for others. We're working collaboratively with the Commonwealth. There's still much work to be done, but for New South Wales, we must continue to take the lead. For New South Wales, making funding reform work is a key part of how we lead our own system towards better health outcomes. Funding reform lets us shape a hospital system that needs constant refreshing and new directions. The one certainty about health is that new science and medicine emerges every day and that we need to keep changing fast just to maintain our edge. And as the Minister for Medical Research, going around the institutes, talking to the researchers, talking to the clinicians that are engaged in that transitional research, it's just mind-blowing, it's inspiring, but we need to make room in our budget to adopt these new treatments. For the people of New South Wales, knowing that their health system and their hospitals are constantly responding to change is reassuring. It means they know they have a system that is moving forward, improving, adapting, continually striving to meet their needs. Funding reform is the next step in our quest for a better health system. It will not be the fast change we make, the last change we make. Rather, it is another practical move forward that will make our hospitals as effective as they can be. As long as we keep setting the pace of positive change directed to opening and freeing up the New South Wales health system, we can all be confident that patients and consumers will remain at the heart of our efforts and at the centre of why we make decisions. That's the key to the change that starts on July 1. All of us here are part of that change, and I trust that you will all join me in embracing the opportunities that arise from the funding reforms so that we will be able to answer yes when that consumer asks us the question, will there be the right treatment, the right health care at the right hospital available to me when I need it? Thank you. I look forward to joining you in this new reform. Thank you.